Yesterday, the National Assembly adopted the National Health Insurance Bill, and there's been mixed reaction since this happened. Trade Union Solidarity says that it is unhappy, and we were going to speak to Peirru Marx, who's the network coordinator of the medical industry at Trade Union Solidarity. Good evening, Peirru. Are you there?
Good evening. Yes, I am.
Welcome to the program, and thanks so much for making yourself available this evening. Reports suggest that you have instructed your legal team to prepare for battle. Is this true, and why?
Yes, this is most definitely true. I think from our side, Solidarity is always during our presentations with, during this whole process against the bill, have indicated that it's not feasible, it's not implementable, and we will be challenging this bill because, unfortunately, like I said, it is a nice promise to tell people that they will have quality healthcare and access for everybody in South Africa. But unfortunately, the reality is that government has failed in the public sector and now wants to nationalize private sector and expect the private sector now to take care of what they have mismanaged over the last few years.
Do you feel in the run-up to the adoption of the bill that your thoughts in terms of public comment or official comment have been ignored, that the concerns that you're raising have been sidelined?
Yes, most definitely. Even during all our presentations, during governments, during our presentations to Parliament, we have indicated that that's simply not possible for this bill to be implemented. It cannot be. It's not affordable. All stakeholders, all comments that has been submitted, it seems like government is just ignoring this, and they're simply moving forward to push through this bill. And we can't help but feel that this is the last attempt for government to get some votes during the next year's election process.
We'll be speaking to the Deputy Health Minister a little bit later on in the program. But one of the concerns you have, which actually is a concern that's echoed by a few experts in the sector, that the adoption and implementation of the bill is going to lead to a huge exodus of medical professionals from South Africa. What official verification do you have for this? Why is it that you believe that this is what's going to happen?
Yes, look, Solidarity Research Institute has done a research under our healthcare practitioners and our professionals, and the indication has been always that they will not be working under NHI. Simply put, our belief is that healthcare should be left with practitioners. Government cannot simply go and claim the healthcare practitioners for themselves. They should upgrade their facilities, obviously enhance patient care within the current system, deal with the corruption, and basically appoint people that can actually properly manage the system. We do not believe that our healthcare practitioners should now be taken from private sector, and then, you must understand, 17% of our country is dealt with in private sector. The 83% is left in government. Now, because of this failure, now government believes that the private sector should now be nationalized. These healthcare practitioners will now simply move forward. They will fall under the government. And, it will take away free market. It will take away their ability to practice on their own accord. And this is basically why they have indicated that they will not work under this. Even during today, I've received numerous calls from healthcare practitioners stating that we must fight this. They're not willing to work under NHI.
You talk about fighting it. What do you have in your arsenal?
Well, basically, during our submissions, this was done in the form of court papers. We have already started updating these papers with the latest information, and our legal team is prepping and making it ready. Should this legislation be pushed forward, should they continue with this, they will most definitely take this matter forward, and we will challenge this legislation in court.
Well, one of the key arguments, Peirru, when we look at the entire space, some researchers are saying that those who support the system remaining as it is are being supported by big business, the big corporations who run the big medical aid schemes that cover the 16% that you are talking about. That it's all about maintaining their monopoly on the industry. And in fact, it will be, if we can arrive at a situation in South Africa where there is equitable and quality healthcare for all, it breaks their monopoly and loses them business, and that is the only reason why they are so vested.
Well, if you look, we don't have currently even have a funding model for the NHI. We don't have clear indication how they will fund this. The supplementary, obviously, finance that's necessary to fund the NHI. All of these things are not available. There's no clear indication. The only indication that we can draw for ourselves is that this would be additional tax for the taxpayer, additional burden on the private healthcare sector. I mean, to claim that big corporates are now, in favor of NHI, I do not believe that is the case. I believe that you would see clearly from now going forward, parties stepping up to the plate and basically showing that they're not in support of the system. Even, I think the latest information that was received from Discovery is they're not, in the current form, they're not so much in support of this, but I stand corrected. But unfortunately, like I said, I believe that parties are mobilizing. We have challenged some of this legislation in the past, parts of that legislation, and we will continue doing so in the courts.
All right, Peirru Marx, thank you very much for talking to us. We'll, in our conversation just after the 6 o'clock hour with the Deputy Minister for Health, raise some of these concerns that Solidarity Medical Sector Network Coordinator Peirru Marx has been sharing there with us.